Thank you, Mr. President. Yesterday was International Cleaners Day. I want to pay tribute to cleaners working across our communities in schools, workplaces, aged care facilities and hospitals. Hospital cleaners have been on the front lines during the COVID-19 pandemic, and their work has been essential in keeping so many people safe. They have been working in incredibly stressful and high-pressure environments within our hospitals. They are responsible for cleaning wards and other areas of hospitals that have been infected with COVID-19. During the pandemic, cleaners have been left working in unsafe conditions, especially amidst the first stages of the crisis. Cleaners were left without adequate personal protective equipment in New South Wales. The hospital areas and the cleaners were made to clean areas of the hospital that placed them at risk. We know that some cleaners had been given only one mask for an entire week, which is incredibly negligent. Certain hospital wards also ran out of essential hand sanitizer, and cleaners still had to do their jobs in situations that were potentially hazardous to their health. Hospital cleaners were appallingly put in a position where they were required to clean patient rooms without a mask, only to find out that same afternoon or the following day that the patient in the room had received a positive COVID-19 test result. Cleaners then needed to get testing and self-isolate whilst awaiting results. This is an extremely dangerous situation and unacceptable that cleaners have been placed in this situation by the government, Mr. President. Cleaners across New South Wales hospitals are often extremely overworked. When many hospitals are down on cleaners, there is a refusal to hire replacement staff. This places enormous pressure on the cleaners to try and cover as much of the cleaning work that they can during their shifts when they are understaffed. Unfortunately, this places patients, staff and the public at risk, because cleaners are often told to prioritise patient areas, and if there is any time left to try to clean public toilets and hallways, do it then. Most staff areas do not get cleaned, and vacuuming cannot always be carried out due to the refusal to hire further cleaners when staff are on leave. Our hospitals should always be fully staffed. Anything otherwise is simply unacceptable, especially during a pandemic. The work that hospital cleaners undertake is extremely physically hard, mentally draining, and during the pandemic it has been highly stressful. Cleaners have unfortunately been facing a lack of recognition, low wages and often poor treatment at many hospitals. There are privatised cleaning providers in our hospitals that refuse to provide a proper wage increase to poorly paid cleaners. Many hospital cleaners are now facing a pay cut in our hospitals due to the Berejiklian government's actions. New South Wales hospital cleaners are already amongst the lowest paid in the country. While hospital cleaners have been on the front lines protecting our communities during the pandemic, the Liberal and National government thinks that the best way to thank these workers is with a pay cut. Last week we found out that the Berejiklian government has been spending $1.2 million on indoor plants for one of its buildings. It is unbelievable that the Liberals and Nationals think it is more important to be spending over $1 million on some indoor plants for an office building, but will be trying to cut the wages of workers like these heroic hospital cleaners. New South Wales cleaners do not deserve a pay cut, they deserve a pay rise. I would like to thank the Health Services Union, the HSU, for all the work they do to support cleaners and other health workers. The HSU have been out there every day during the pandemic advocating for workers, along with supplying hand sanitizer and masks where needed. The pandemic has really demonstrated the important work that hospital cleaners do to keep our communities safe, Mr. President. The work of these heroes allows hospitals to remain open by keeping infectious diseases outbreaks from occurring in hospitals. Cleaners across our state save lives with their extremely important work. I want to thank all the cleaners for your hard work. You have been lifesavers. Please know each and every day that you are valued and appreciated as the most valuable jobs in society.
Honourable member's time has expired.